We know that on average a resident of York will access emergency care once every 5 years, but for a smaller group of the population, the top 1%, the story's quite different. That group of people will access emergency care once every 3 months. They have 10 to 15 care contacts during the year, and they account for about 55% of our emergency bed days, which creates pressure in the emergency department and financial pressure for the system. We've been looking for innovative solutions to how we can help that group of people meet their needs, and preventative strategies are clearly an important part of that.
We were given a unique opportunity to become the first clinical commissioning group in the country to work with Health Navigator, a Swedish company, on their proactive health coaching model. It's a model that they've used over in Sweden with quite a significant population-based access in the service, but this was the first time it was being rolled out in this country. What that meant was it was an opportunity to build on a lot of the kind of integration and collaborative work that we were trying to do with our primary care services, but also with our hospital providers as well. And it all really kind of complemented and came together to do that. And what Health Navigator do is they run a very clever algorithm and formula to try and identify people who are at risk of accessing and becoming high users of secondary care and hospital provider care services. And with a view to putting in place health coaches who they access via a telephone kind of based approach to support them and coach them through how best to cope with and manage their conditions, whatever they may be, how they can best access services, where they can go to access services, and tries to provide a more comprehensive healthcare package with a single point of contact for them to go to access all of that.
What we've found over the last few months working with the health coaches, the proactive health coaching team will identify a patient when they are needing acute hospital services regularly and work with the GP on formulating care plans and trying to understand their needs. Several of my patients, it's made a real impact on their lives having the input of a health coach, and it's been a really great thing for York.
The frequency of the calls can be daily, it can be 2 or 3 times a week, but it's important that the pathway is very clear to the patient so they know where to turn to for that support. In the case of Norman, he was struggling physically, he was not having good symptom control, he was becoming very frustrated in where to go for support and how to manage those symptoms. This meant that he was attending A&E quite a number of times and wasn't actually having a clear plan on how to manage his health conditions. Together we worked out what was necessary to stop Norman going to A&E, which was not necessary, and what was it that he needed to get his life back on track.
It's come with very, very strong evidence base. We're having to comply with lots of kind of rules and regulations around that, but we're already seeing some really strong early results, both in the intended benefits we thought we'd see in terms of how people access, or more specifically don't access, emergency services and don't have an admission into the hospital, but also some of the unintended benefits. So when they're going into primary care, they're better informed about what they can access, and generally speaking they're more confident and comfortable in managing their own conditions so they don't reach a crisis point. And that means that the patient experience is better, but also in terms of the secondary care and primary care providers, they're less reliant on those services because of this service.
When I was going through all these problems, I just didn't have the energy to do anything at all. Everything was difficult, you know. But since this lot has sort of been resolved in a way, and with Jerry's backing, I'm getting it together and I'm getting better. Until I'd had all this massive going on with the illnesses, I didn't know a lot. But since then I've gradually found out what my own body's doing, you see. So that's helped greatly. I'm grateful that she was there for me. Okay.